6 in 10 Singaporeans suffer from hair loss, and most of them are men. I'm Dr. Elias Tam, and I've been a clinical lecturer with the University College London, and I've been educating doctors and the public about hair loss. And after over 30 years of treating hair loss, I can tell you that hair transplant may be one of the best long-term solutions. So before we consider hair transplant, there will be a consultation pre-assessment. First, we will have to get a proper history to find out if there's any other cause for the hair loss. If it's a treatable cause, such as hypothyroidism or anemia, to be treated first. And if you can reverse hair loss, the patient doesn't need a hair transplant at all. For most cases, for men especially, it's usually what we call androgenetic pattern baldness, and that may not be sufficiently treated with this medication. It can slow down or even reverse in some cases. For those where the hair has already been damaged permanently, hair transplant is required. There's a strict method. There's also what the FUE, what we call the follicular unit extraction method. And for the follicular unit extraction, FUE for short, there are different methods as well. The best and the easiest would be to shave the area. Some people say, no, I don't want to shave it. Then we can either shave in strip or in individual area. But that would take a longer time and would be a lot more costly. Go to the simple and the fastest, which is to shave it. So we shave the area that we find that is the best quality hair, typically over the occipital area. That said, in some cases, after we have done that, we may harvest also from other areas such as the beard. If they're good beard, let's make sure that the quality is good and we will harvest it. How do we harvest the hair? So what we are after, we are actually after the entire, very near to the, you can see that where the hair or the muscles is attached. Near to it, there's actually the stem cells. And these stem cells are what we are after. The hair has what we call donor dominance. In other words, you retain the original pattern, being resistant to DHT. DHT refers to dihydrotestosterone, the metabolites of the male hormone testosterone that often lead to hair loss. Harvest it first from the back. We will prepare it to trim it down to make sure it's nicely trimmed. We will then next prepare the recipient area, clean it, and we may mix small slot over it, and then we will put in the hair one by one. We first design the area that we want to transplant, depending on the individual area. With the area that has the most amount of hair loss, we will need to count the number of hair that we want to place there. And depending especially over the forelock, which is the forelock, that is typically the most important area, and then followed by the lateral side. Once we have designed the hairline, count the number of hair we want to transplant, make the necessary number of slots, and then we place the hair one by one. It's important for the direction as well. Depending on how the person's natural hair is directed, we will follow the same pattern so it looks natural and it restores what they used to look like.